we have actually Letitia here, who is from Tennessee, right?
Yes.
Tennessee. So this is really cool. This is the first time we're doing a remote one for so far. Miss Burton actually put me in touch with Letitia and some of her colleagues or acquaintances and stuff. So she was one of the first ones to reach out. So that's why I asked her if she would talk to you all who are joining us about her job. So I'm going to go ahead and start with, and we'll just to kind of do this informal style. If you have a question, please put it in the chat to be answered. But I have got some initial questions for you, Letitia, to tell us about a little bit about yourself and what you do and what your career path has been to where you are now.
Okay, I am a surgical nurse practitioner. I've been a practitioner for 5 years now. I started off being a registered nurse in 2003, where I worked critical care. I worked on the floor. I worked in the emergency room. I did everything but babies. I couldn't do the babies. Then after 10 years, I decided it was time to go back to school and live a normal life because I worked nights for 20 years. So went back to school, got my master's in nursing, and now I work at a surgical center. So people that come in for surgeries, we do back, neck, and joint surgery, so hips and knees. So they have to see me before they can have surgery because I have to make sure that they are healthy enough to have surgery. So those are the things that I do.
Okay. And you said, I think one of your first jobs was a nurse technician.
Mm-hmm.
Can you tell me the difference between what a nurse technician is and what a registered nurse is and what a nurse practitioner is, the difference between those?
Okay. So as a nurse technician, you work under a nurse. You're more hands-on with the patients. You do their vital signs. You can help get them out of bed, help walk them around, help take them to the bathroom, things like that. So you're working under a nurse, but you're still helping a patient with what we call activities of daily living. So that's what.
And what is the education required for the nurse technician?
I did it while I was in school. So if you were in nursing school, as long as you had your first semester of nursing school, then you could be a nurse tech. But if you just wanted to do that, they have programs where you can get certified, where I think it takes like a year or two for certification. And then for your RN, you can either do a 2-year degree or a 4-year degree. 2-year degree is associate's degree, and a 4-year degree is a bachelor's. I did my 4-year degree. And the difference between a 2-year and a 4-year is pretty much management. If you want to go into a management position, you can do the 4-year. But if you just want to work bedside, you can do a 2-year. But if you want to possibly go further, you have to have a bachelor's, the 4-year degree.
Okay, and did you go to school in Tennessee as well?
Mm-hmm. I went to Tennessee State University.
Just out of curiosity, is that an impacted program? Because I know in California, there's a big problem with that with some of our public schools.
What's the problem? What do you mean?
It's an impacted program. The programs that have been impacted, the nursing programs have had a list. Or it's tougher to get in. It's competitive.
Oh, it's competitive, but there are quite a few programs. Tennessee State has a program, Belmont has a program, Vanderbilt has a program. Go a little further down, Jackson has a program. They have an online program. So they are competitive to get into, but you have different programs. So if you just want to shoot for one, then you're going to make it harder for yourself. But I was able to get in. I think at the time they may have allowed 60 people in, but by the time we graduated, it was only like 30 because some of the people just couldn't handle the coursework.
Can you talk a little bit about the coursework required for the nursing program that you did?
Yes, a lot of science, math and psychology, a lot of psychology. We had to have a basic foundation of math for the drugs and prescriptions, just in case you needed a prescription and you need to be able to figure out how much the patient needed. You need to be able to calculate it in your head while not just assuming that the pharmacy will give you exactly what you need, because that's not always the case. The sciences, of course, so you can learn the human body. So AP, anatomy, chemistry, microbiology. I took a lot of that. And I took sociology and several psychology classes.
Okay. Are there any classes in particular that help you the most to what you're doing now that you've taken in school?
In high school?
This in college, in the program.
Oh, the main thing is focusing on your science in your psychology classes, because everybody is different, so you don't treat everybody the same. So you have to understand the person that you're treating, because one person's way of pain is different from another person's way of pain, and you have to understand everybody's culture is different and what everybody expects is different. But the main foundation is science classes, your basic biology, chemistry, anatomy. And in which in school, I didn't like those classes, but I learned to push through.
Okay. And then you're a nurse practitioner now. So what is the difference between a registered nurse and a nurse practitioner?
So now I can write orders for my patients. Instead, as a nurse, you do a lot of executing the orders for the doctors, assessing the patient. Now I assess the patient on a more advanced level. I diagnose, evaluate, and that's the main, that's the main, it's almost like a bridge between the doctor and the nurse, because a lot of doctors were going into specialty areas, because the specialty areas is really where the money is for doctors. So it left a open area for primary care, which primary care is your basic primary doctor that you go to, or your pediatrician that does, your everyday, looking at your weight, your health overall. And so that's how nurse practitioners came into play. It's kind of like we have taken over that role as a primary care provider.
I understand that a lot of nurse practitioners are doing the regular exams that doctors used to do.
Mm-hmm.
And they also write prescriptions and things. So
yes. So that is what we do. In my first nurse practitioner job, we did a lot of the assessments, and we rounded for the doctors when they were off. So I would go into the hospital, see their patients, take care of them for the weekend. Any tests that they needed ordered, any labs that they needed, any medications that they needed, I was the one to take care of that for them. So you work alongside a doctor. It's very close relationship with them. You develop good relationships. But you still have the need that you're a nurse too, where you still have that more bedside. You want to have more of a connection and relationship with your patients.
Is it my understanding? I don't know in California that you have to be a registered nurse for 5 years before you become a nurse practitioner. Do you have to have that experience?
Not here, and I almost wish that they did, or at least 2 years at minimum. But here, you can go straight out of bachelor's, a 4-year degree, and go in the next semester for your master's. I don't suggest that. Some people do, but you don't have a critical care background. You haven't worked long enough really to understand how to assess somebody, when to see that there is a situation that's starting to arise, when the emergency is coming up. You haven't really learned that in school. You don't really learn that until you get into the field. So I do recommend waiting before you go right back to school. So that's a good thing that California has that. Tennessee needs to have something like that.
And the master's, is that a 2-year master's program for the nurse practitioner?
Yeah, 2 years.
Okay. And so would you say the skills you need to become a nurse practitioner or a registered nurse? What kind of skills, either soft skills, hard skills, those kinds of things are needed for the job?
The first thing I always tell people is common sense. If you can look at somebody and you can sense when something is not wrong, something is not right, That's the first thing. You need to be compassionate. You need to be caring and understanding and patient. You have to have a lot of patience, especially if you are on the hospital floor and you have 5 or 6 patients and you have to give all their medications within an hour. One person is asking to go to the bathroom, one person is sick, throwing up. You have to learn to manage your time and figure out which priority is most important. So I would say those are some of the main things.
And can you walk us through do you have a typical day? What a typical day looks like for you? What about how many hours a week do you work? That kind of thing.
Okay, so I work 40 hours a week. I work 4 10-hour shifts. So Wednesdays are my off day. So when I go in the morning, I look at the schedule, see how many patients that I have coming into the clinic, because I work in an outpatient clinic the majority of the time, but sometimes I still have to fill in and see the patients after they've had surgery. I'll go in when the nurse gets the patient ready, meaning she gets the history together for me, or they get the medications together, get the dosage together, and set the room up. So then when I come in, I go over their medications, go over their history, see if there's anything that would concern me to say, you don't need to have surgery, or, moving forward, surgery will be fine. Or if you're at risk, what do I need to do to make sure you will be a good candidate for surgery? So I may need to order a test, order exams like a chest x-ray, or send somebody, to have their heart checked out or have their lungs checked out. Then once I'm done seeing the patient, I go into my dictation room, make a dictation note on the patient, and then I will send that note to the surgeon for the surgeon to look at before they have surgery.
Okay, and so are you used to that 4 days? You have 3 days off. So is that something you like, that schedule? Is that flexible?
Yes, it is. Working as a nurse, I work 3 days a week, nights. So when my kids were younger, it really worked out. My husband worked days, I worked nights. I was able to pick them up from school. If we ever had snow days or out of school days or doctor's appointments, I was able to take them without any issues. Now I did lose sleep, having to be up all night and be up during the day sometimes, but it worked out. But now that they're older, I don't have to do that anymore. So I do enjoy that I have one day during the week if I need to do things that I could do it like today, because I wouldn't be able to do this at work because we don't really, get a break. So, but I do love that I have options, that I can still get things done.
So do you have any kind of crazy or funny stories to share about being on the job?
Yes. Let me think. Oh, let's see. We had a patient one time when I was working as a nurse, when I was still in critical care. The guy came in, he was bleeding, blood coming from his mouth, blood coming from his bottom. So call it a GI bleed. He was so pale, we were trying to get blood in as fast as the blood was coming out. So one of the nurses that I was training at the time put the blood on a bag that we call a pressure bag, where the pressure bag squeezes the blood in faster so we can, hurry up and get the blood in. Well, she squeezed the bag too much and the blood popped out everywhere. So in the middle of all, trying to save this man's life, we just see blood spewing on my face and my hair, on my clothes. So as that's happening, the man stops breathing and his heart stops. So now we have a cold, but we can't see, and we're already shook because we have all this blood on us. So the doctor is there, I'm there, the charge nurse is there, the girl that's orienting is there, and we're like, okay, one person is blindly trying to do chest compressions, to get his heart back pumping. We called the respiratory therapist in there, trying to get them intubated with blood just coming all down our face. And the doctor's like, I'm sorry. And he's trying to take a towel and wipe the blood off of us. And I was like, you know what? I know this man is dying, but I can't see. So if I can't see, we can't save his life. So that's one of our little things that has happened at work.
Did he live?
He did live.
He did live. Okay.
Yeah, he did live.
That's good.
Mm-hmm. Yeah,
Okay.
everybody doesn't live, and you know that's the downfall, that you have to learn to deal with death. So what I realized working, especially in the unit, critical care, that some people are just supposed to die, and when it's their time, you're okay with it, and you know you've made peace with it. But then when you have the ones that wasn't expected to die, those are the ones that really affect you, and you go home thinking about that, and it's heavy on your heart. So.
Right. I would think that would be hard for someone to get used to.
Mm-hmm.
So what do you like the most about being a nurse?
I like helping people. I love dealing with the older population. When I was in school, I always thought, like the majority of us, oh, I just want to work with the babies. I want to do this. But the job that presented itself to me was working on a med-surg floor, which that means just, you know, people with common everyday problems that need to be hospitalized for it. And I realized that I love talking to older people. You know, a lot of them don't have people to talk to, or their families have gotten so busy with their own lives that they don't sit and listen to them anymore, but they really have the best stories. You know, they appreciate you more for just being there and sitting with them and talking to them. So, but I do appreciate that.
And what about the least? What are things about the job that you like the least?
I really don't like that a lot of patients have started to think that being in a hospital is more like a hotel, where, oh, I need this and I need this and I need this drink, and I bring me 3 more of these. And I want to say, ma'am or sir, you know, I have 6 other patients. I can't keep bringing you Cokes every 10 minutes, or I can't keep bringing you a Sprite or peanut butter and crackers, things like that. But I also hate that people are getting sicker because they're not taking care of themselves. You know, we're starting to see patients are a lot bigger than what they used to be. They're a lot sicker than what they used to be. And we don't have the room like we should to take care of those kind of patients.
Are you in a hospital? So it's part of a bigger hospital? Is that the setting you're in?
So I'm in a surgery center. We have a floor where we do the surgeries, and we have the rooms for the people that need to spend the night. So we have 1 level floor. Well, really on 3 levels, but 1 floor is for the consults, the pre-op consults, and then the other 2 floors are for surgery and when they come out of surgery. But I was in a main hospital, but I left in February, where I was there for 2 years.
And what types of surgeries are they having where you are?
They're having neck surgeries and back surgery. So, like, you know, if people are having neck pain, or their arms or legs go numb, tingling, they're burning, or all of a sudden they're having trouble walking, having trouble going to the bathroom, or they can't control themselves anymore. Deal with that. Or people that need to have knee surgeries or hip surgeries, we do that as well. And carpal tunnel, for people that need to have their wrist done, we do that.
Okay. So about how long do you have each patient for? Is there a typical time you see them right before they have surgery and then take care of them afterward? Is that what?
Ideally, we like to see them a week before surgery, but that's ideal. We'll have patients that come into the surgeon's office, and once the surgeon looks at their imaging records, like the MRIs and the CT scans, and they decide, you know, we can't wait on this, or the patient lives too far out, then we will see them the next day. So the patient will typically see the surgeon first as a consult to decide if they can have surgery or not. Then the patient will come to us. Then if they have what we call a fusion, where they're going to put like hardware into the back or the neck and fuse it with the rest of the bones, they have to go to a class so they can learn how to, you know, deal with that after surgery, and like no lifting, and, you know, how to bathe, how to shower, things like that. So that will take like another hour. So seeing maybe me and the nurse, 30 to 45 minutes, depending on the patient. If they have to go to the class, another hour. Then once they do have surgery, depending on what the surgery is, the surgery can take anywhere from 1 hour to 5 hours, depending on how big the surgery is. And then when I see them out of surgery, it's quick. I may be in the room 10 minutes, the first day out of surgery. The next day, I'm in there a little bit longer once they have, they'll wake up, they're, no longer under anesthesia. They've had time to get up, move around. So I can assess them and see how their night went, see how their pain is controlled, make sure they're not nauseated, make sure their blood pressure is not through the roof, things like that.
Okay. And do you have any advice for any students who are looking to get into this field?
Mm-hmm. I would say the first thing, make sure you take your science classes if that's what you want to do. Make sure that you're compassionate. Make sure that you're not somebody that can get ticked off easy or, impatient. Nursing will never go away. You'll never have to really worry about a job. I don't know, in California, I know it's a union, but you can travel the world and get paid by being a nurse, because they do travel nursing all the time. If you don't like that, don't like the blood, you can go into the office. It's so many different avenues with nursing that it's endless possibilities.
Great. Some students had asked questions. Madeline, did you want to ask your question or should I just read it? Madeline.
Yes. I can see it. What do you suggest?
You can see it? Okay, so Madeline asked a question. Madeline, you want to ask your question?
I'm fine either way. I could read it.
Go ahead. Yeah, Madeline.
I've said, what do you suggest we do to prepare or better our chances at getting a job like this at this age?
Good grades, getting into school. Try to keep your grades up. And they always love community service. That always looks good, helping in the community. Don't just be a person that goes solely off of grades, though. If you're doing things at a church, doing things in the community, getting to know people that are working in the field can always help plug you in. Those are ways that you can get in as well.
Thank you.
Okay, Anna. Anna, do you want to ask your question? Anna. Okay, Anna's asked, you want, for the nursing, 1 semester of nursing in order to work as a nurse tech. I know that some programs, like some community colleges have nurse tech programs that are at the community colleges. In your circumstance, was it a 1 semester or 2 semesters, or how long did it take?
No, so because I did a 4-year degree, I had to do my prerequisites to get into the program. So I was in school for 2 years before I was able to get into the nursing program, taking my basic classes like math, social studies, history, PE, things like that. But once we had our first semester of nursing school here in Tennessee, you can be a tech if they know you're in nursing school. Because that first semester is pretty much the same as teaching how to be a tech. It's teaching how to take vital signs, teaching how to give a bath, how to turn a patient, how to make a bed, things like that. So if you wanted to just be a tech, you wouldn't have to need to go to nursing school. You just have to take a program at a community college. But I wasn't at a community college. I was at a university.
Okay. And I'm not sure about California. That might be the case here as well. I'm not sure. Mm-hmm. Every state is different.
Yeah, they're all different.
And Nicholas, do you want to ask your question, Nicholas?
Yeah, sure. So I was wondering, usually a lot of people say, what kind of person do you recommend to be a nurse? What kind of person would you not recommend to become a nurse as a career choice?
What type of nurse would I not recommend?
No, what kind of person would you recommend? Like certain personality traits that you say, if someone had that they shouldn't aim to be a nurse.
I would say, you're saying the traits that you need to have or not need to have?
Not.
Oh, okay. You cannot be impatient. You cannot be judgmental. You cannot believe that your way is always the right way. You have to understand that different cultures do things different races do things different. So those are things that you need to keep in mind.
All right, thank you.
You're welcome.
Natalia, do you want to ask your question?
Yes, thank you. Earlier you mentioned the story about how the blood bag kind of exploded on you. So I was just wondering if, like, while you were doing your schooling and starting out as a nurse technician, was like seeing blood and being around blood something you had to get used to, or like it never really bothered you?
I think all nurses have something that gets to them. Some nurses, their thing is blood. Blood doesn't bother me at all. Some is poop. Some can't deal with the poop. That doesn't bother me. What bothers me personally is spit and saliva. Like I, would take care of patients that have the trach in their throat, and like they talk and they're coughing, the phlegm is coming through that, and I'm like, oh my God! The first time I saw that, I thought I was about to pass out. Like I was getting hot in the room, and I was seeing lights, and I was thinking, I'm gonna fall out in this room. I'm gonna be so embarrassed. But if this spit gets on me, I am gonna die and just go on with the Lord.
I have a follow-up question to that. So if you are a person that's kind of more sensitive with things like that, how far would you take, like if you wanted to enter the nursing field, how far would you take it, and then like what level of nursing would you stop at?
But it depends on what you want to do. Like I said, there are so many different avenues that you can do. If you don't like the blood, you don't like, the body parts and all that, the liquids that you get, you can do case management. A lot of nurses do case management where it's almost like a counselor at school, just in a hospital setting. They help set people up to find places to go when they get out the hospital. They help set them up for rehab if they need transportation, so they don't even deal with the patient in that essence anyway. Or in the case like me, ultimately I went back to school because I was just tired of working at the bedside. My back was starting to hurt after, 15 years of doing it. So now I'm in a situation that I really don't see any of that anymore. And the time that I do is far few and in between. Somebody is crashing and we got to fix.
I think you're frozen, Letitia. I think your camera's frozen. Letitia, are you there? So I know, well, there you go. Can you see us?
Mm-hmm.
Okay. RF had a question. RF, you want to ask your question?
Yes, hi. I heard you mention that you were a nurse tech and that your duties concerned, like, you worked under the nurse, taking vitals and ambulating the patients with their ADLs and stuff.
Yes.
How does that differ from the roles of like a CNA, especially like in Tennessee? Like, is it just different titles?
It's just different title. Depends on where you go. Some person's gonna call it a CNA, some person's gonna call it a nurse tech. I've heard it called care partner. It's all the same.
But in like Tennessee, it'd be like nurse tech or nurse technician. Is that what all is?
It just depends on where you are. It is the facility. Some facility call them nurse tech. Some facility call them CNA. Same lingo, just a different, doing all the same thing.
Right, thank you.
Okay. Nicholas, you had another question?
Yeah. Sorry, I'm back again. So my other question was like, what was the first big challenge you kind of faced on your career or on your path to becoming a nurse, you would say?
My first was building up my confidence to take care of somebody. Like I remember coming off of orientation after being on orientation for 3 months and was like, oh my God, they are trusting me to take care of people. Like I can barely take care of my child because I was a single parent at that time. I was a teen mom. So I was thinking, oh my God, this is not the same. Like I at least have my mom at home to help me. Who's going to help me with these patients? So it took me to build up my courage and get some background under me to start to feel better. So that was my first challenge. It's just getting over the fear of taking care of the patient.
Okay. Liliana, you want to ask your question?
Hi, I was just wondering, because like math has never been like my favorite thing. What math classes did you have to take in becoming a nurse?
what did I take? So in high school, I did the algebra 1, algebra 2, geometry, trig, and calculus. When I got to college, I took college algebra 1 and 2. I took trig. I think I had to have 3 or 4 different maths. But once you get them done, you don't have to worry about it. It's over.
Okay, thank you.
Honestly, they want you to have the background to learn how to convert drugs if you need to convert it.
Mm-hmm.
But the pharmacies really do it for you. You know, they just want you to have the background if something happens and you need to do it yourself.
Okay, thank you.
You're welcome.
Layla, do you want to ask your question?
Sure. I was wondering what the viruses would be used for a specific center during this time. Because I've noticed that a lot of like different.
I can't hear her.
We can't hear you. I'm going to go ahead and ask it. There's something wrong with the microphone. Layla was asking about how are nurses dealing with the coronavirus right now, where you are.
It's very heart-wrenching. Tired, putting in long hours. You're just stressed at work because so many people are sick. You don't have enough room and beds for those patients that are sick. And then you don't want to bring it home. So some nurses are staying at the hospitals. Some nurses have rented places like Airbnbs and hotels to stay at. Some I know are coming in through the garage, stripping down all the clothes in the garage. I have a robe or something, take it upstairs and go take a shower as soon as they get home. So it's been very stressful. And because it's also been the way the country has dealt with it, has kind of been a slap in our face. You know, like when we were hearing about how it was going in China, we could clearly tell it was a disease that was airborne, and, you know, so we knew, okay, hey, we would need to wear a mask. And when we first started, the hospitals were like, oh, you all don't need to wear a mask. And we're like, they're wearing masks in China. Why would we not wear a mask? So it went from that to eventually we could wear the mask, but we didn't have enough masks because the country was using them everywhere. So we had people coming in and making us homemade masks, like churches and different organizations. Well, then it was, well, you can't wear the homemade mask because it hasn't been approved. So we felt like, so you want us to take care of a possibly infected COVID patient and not be protected and potentially take this out into the world and, you know, infect others, because we still have to go to the grocery store or, you know, take care of our loved ones and things like that. So then the next ball was, okay, you all can wear a mask. Then it became, you all can wear your own personal mask. So it's been so many different avenues that it's been very tiring and mentally draining, dealing with these patients, because you want to see them get better, but you don't want to bring it home, or you don't want to infect your loved ones, you know, to take care of somebody else. But ultimately, that's what you signed up for. So it's not like I can say, well, I'm not going to work because I don't want to deal with corona. That's not in my character to say that and feel comfortable with it.
All right. Well, how has COVID affected you or your personal and work life?
Actually, because we are a surgery center and we do elective surgeries, meaning surgeries. An elective surgery is a surgery that doesn't necessarily mean that it's necessary, like a knee surgery, hip surgery. It's actually just taking our numbers down. If the patient tests positive corona, they absolutely cannot have surgery because we only have 4 or 5 surgery rooms, operating rooms. So we don't want to risk infecting that room and infecting the floor because it's a small area. So actually our clientele has dropped drastically when they said no more elective surgery. We've only operated now probably 25% of what we normally work. And we were put on to work at the main hospital because we're governed by a main hospital that's just 1 block away. So I have credentials and access to work at that hospital. So I was put on standby. So if one of those nurse practitioners couldn't work, then I'd have to go work there, which luckily I didn't have to do that. But here in Tennessee, the governor has lifted the ban for us having surgery. So now we will start back having surgeries on Friday. So like Thursday, we don't have any surgery scheduled, but Friday we have 27.
Wow.
Yeah, so we're back on the ball.
Okay. Summer, do you want to ask your question?
Sure. So I know that a lot of the people in this Zoom are like part of sports therapy or sports medicine classes, and they're like active student athletic trainers. Would that look good on like college applications?
Anything that you do looks good on a college application. They just don't want you to be a person that only goes to class and that's it. They want you to be a well-rounded individual. I have 2 kids in college, and that is what they look at. Of course, they look at your grades and they look at your test scores, but they want to see what else can you do. Even if you're in the choir and you want to be a scientist, well, that means, hey, you can just do more than one thing. You can multitask. You're the type of person that we want to say, this person goes to our school. So you don't have to necessarily be specific to the field. Just be a well-rounded person. It could look good, but just find something to do.
Okay. Anna, you want to ask your question?
Yeah, so there's nursing programs at university. I was wondering if the nursing programs at university is the same as what you've mentioned earlier as nursing school.
I don't know.
Yeah, you said you went to a 4-year university, right?
Yes, I went to a 4-year university. So we had the option for a 2-year or 4-year. It's almost like if you still want to get the real college experience, some people just want to go to school, get their degree and go on. Then if that's the case, you can do a nursing school where they can possibly have you out in 2 years and you can get started for work. But if you want to say, hey, I want to do the college life and I want to experience those 4 years, then definitely do a university. Because I can still say, I still enjoyed my college parties and I still had fun. I still had organizations and joined a sorority, where if you just go to a nursing school, you won't get that. But it's up to what you want to do and the type of person you are.
Yeah. Adrian, you want to ask your question?
Okay, what is the salary like?
Good.
So at different levels, obviously, depending on education, right? So
yeah,
starting as a nurse tech, I'm sure, is a lot lower.
Oh, yeah. And you have to realize it also depends on where you live, the state.
Mm-hmm.
It goes off of that. Like California makes way more money than we do, but your cost of living is more expensive. So it really goes off the cost of living. Where you could work in California and make, I don't know, $60 an hour. You come here, you make 40, but it's not as expensive. The rent is cheaper here, and mortgages are cheaper for homes. So that's what affects it. It's not that, but you won't get as much money. Each level has a different, pay grade. So of course the nurse tech or CNA, however you want to call it, they're not going to make as much as the nurse. The nurse is not going to make as much as the nurse practitioner. The nurse practitioner is not going to make as much as the doctor.
Right. I just wanted to give there is a great website called the Bureau of Labor and Statistics. It's B as in boy, L as in lamb, S as in Sam, BLS.gov. And there's so much information. If you want to just put in a career in, it breaks it down not only by state, by career, by state, but also by region. So you can look up the Los Angeles region and find out how much exactly different jobs make. And also the fastest growing careers. And you're right, Letitia, nursing is something that'll never, ever, ever, ever go away. And this is one of the best careers to get into if you want a job for the rest of your life.
It is, and especially with the corona, I think this is one thing that it has shown, that healthcare is a priority job as opposed to other careers, or athletes or musicians. And I'm not knocking any of it because I want you to do whatever you want to do. But I have had so many phone calls and emails about coming to work, you know, at a high impacted corona population and going to a different state and things like that, because we're needed right now. Healthcare is booming. So if you want to, if you can't think of what you want to do, nursing is always a great option. And because there's so many different avenues, you'll always have a job.
Right. Okay, so where were we?
Yeah.
Nicholas, you had a question.
Yeah, so I was wondering, like, I've heard in the past, like, how different are like nursing practices across the world? 'Cause I've heard like the way they practice nursing is like different from country to country.
It is different from country to country, and I can't say personally because I haven't been other places, but I have worked with people that have been doctors and dentists and nurses in other countries, and they have come to the States and they work as techs because the education is not the same. In our eyes, it's the same, but if they haven't actually gone through a proper program here, then they're not recognized in their category, in their job. So they, you know, just come with the background. And some of them do end up going to school here so they can, you know, do what they were doing in their own country. But I also think it's the type of country, like your European countries, they have a good healthcare system. Your lower economic countries, they don't have a good system, you know, places that don't really have hospitals or don't have the means to manage healthcare. Your nursing skills may not be the same as the nursing skills here in the States or here in Australia or China, things like that. So it depends on where you are.
All right, so to kind of follow up on that, then, would you still recommend people to like study abroad to like learn about different nursings on top of that?
You can never go wrong with learning abroad. It's always because you're getting more than one lesson. You're getting to see how those people live. You're getting to understand and respect a different culture. You're getting to see somebody else's view of the world besides the one you were raised off of. So I would always, if you could study abroad, why not? Or if you could study on the other side of the world or other side of the country, go for it. That'll be one of the best experiences you'll probably ever have.
All right.
Gabriella, you want to ask your question?
Okay, hi, yes. So earlier in the interview, you said you were like talking about dealing with dead people and like just accepting it was their time to go.
Mhm.
Has there been a death that you witnessed on the job that affected you the hardest?
Yeah. Let me think of one. I've had a few. One death that I had that I can remember off the top of my head, it was a lady that came in for shortness of breath, where she had been there for a few days. Long story short, she ended up throwing a clot. We had to put her on a vent. She didn't make it. She was estranged from her family, so this lady was dying and no family was around. When they went and looked at her purse for her, you know, try to find an emergency contact, we couldn't find anybody. So I went on to Facebook, Googled her name in Facebook, and we had a mutual friend. So I had to inbox the mutual friend for her to get in touch with the family, for the family to come up to the hospital. She had twin sons that were, I don't know, in their 20s. So mom had been in there for a week. Nobody knew that she was sick. And then when they get up there, she's dying. And she was holding on by a string. We had her bed flipped upside down, like her feet was up here and her head was down there to try to get the blood to rush to her heart and her brain so she could stay alive. We had her on all the medications we could to keep her alive. So that bothered me in the sense that lady was about to die alone and her family didn't know that she was even that sick. That one bothered me. Another one that bothered me, when I was working in a trauma unit one night, this lady that had her and her 2 grandchildren, she ended up having a seizure while she was driving. She killed one of her grandchildren, died in the car. The other one made it okay, but she woke up and she was paralyzed from the waist down, and the family didn't want to tell her that one of the children died. So that was, she didn't die, but it was just sad dealing with the family having to deal with the loss of, you know, the grandmother having a seizure and the grandchild dying, and, you know, she missed the whole funeral. So, but there are certain cases that they do bother. If it's unexpected, it bothers you. You just have to learn how to deal with it.
What do you do to handle your stress? Is there something that you do to deal with the stress, or?
A walk. I'll go walk outside, get fresh air. I'll pray about it. I'll go into a room and cry if I need to cry, to get it out and feel like I'm cleansing my soul when I do that. So those are the things. But my main thing is, you know, to walk. When I get off work, with when I used to, those type of days, I would either go to the gym and get on the treadmill for 30 or 45 minutes, or come home and walk in my neighborhood to, you know, just relieve my mind.
Okay, is there any other questions? I don't see any on here. Any other piece of advice you want to share with the students?
Have you ever been in a situation where you felt more than that?
Oh, yeah.
Oh, Ava had a question.
Okay, Ava. Ava, you want to ask your question?
I can see it, Ava.
Yeah, okay.
So it says, have you ever been in a situation where you felt more could have been done? Yes. I was dealing with an older gentleman. I can't remember what was wrong with him. But when the doctors came around, his oxygen stats were so slowly dropping, and I, you know, told the doctor, I'm like, his oxygen has been dropping a day, but, you know, it hadn't been bad, but, you know, like earlier he was like 95, now he's like 90, 91, but, you know, he's still talking and he doesn't look distressed. His color looks good. By the end of the shift, that man died, and I felt so bad because I felt like I should have explored more into why his oxygen was dropping. And, you know, when the doctor and his team came, I was just so upset, and I was just, you know, I kept apologizing, and he had to say, okay, Tish, you done, you know, you can't save everybody. It's not your fault. You don't know, you know, we don't know, and you can't blame yourself every time something happens the way you don't expect it for it to happen. So yeah, that one really bothered me because I felt like I should have paid more attention to what was going on.
Okay, thank you. Karina's mic is broken, so she asked, do you like working in a hospital or smaller surgical clinic better? And which one is more stressful?
The hospital is more stressful, but I like working in a hospital because that's really where I got all of my clinical experience and my education. You're not gonna, if I was started off in a smaller surgical unit that I am now, I wouldn't know all the things that I know. So I definitely, more stressful is the hospital, but you learn more. You get to see more. You know, I'm only dealing with a small population of patients, where when I was in the hospital, I saw everybody. So, but now that I've done it for so long, I'm more on a, let's just take it easy. Let me go to work at 7 or 8 and get off at 5 or 6 and have a regular day like everybody else. So that's where I'm at in my career.
Right. Okay. Well, if that's all the questions, anybody else have any other questions they want to ask? I know in California, we had a nurse practitioner out before, and she made upwards of over 130 to 150,000 a year. So definitely California is one of the highest paid states.
Yeah, they are.
But you're not doing it for the money. So I'm sure, right? It's
no. No, this is, I tell this story all the time. My aunt thinks I'm playing. I originally wanted to be an OBGYN when I was in school. I got pregnant at 19, so my aunt came in my room and was like, you're not going to be a doctor, you're going to be a nurse, so you can get your 4 years and get out and take care of your child. And I was like, okay. So I always say I was bullied into being a nurse, but I do like it. And I'm glad that I went the way I did.
Yeah, and I think that's true because even being a nurse practitioner, you're doing almost everything the doctor does, but you spend more time with the patients. That's what I heard over and over again.
Yes.
Like patient care, nursing is the way to go.
Yes.
And doctors have to spend 12 years in school, so plus.
Yes. Yes. I don't want to do that. So I feel like I have the best of both worlds. I still have the doctor side, and I can, operate like they operate, but I still actually get to sit and talk to the patients, and I do like that.
Well, thank you so much, Letitia. I really appreciate it. You were our first guinea pig for the Zoom interview. Yeah, so I just wanted to mention to the students that we are doing this every Wednesday, sometimes other days, but next Wednesday we have a stress reduction workshop with a Reiki master health and wellness coach next Wednesday, and also a resume workshop with our HR recruiter.
Okay.
So please, everybody, it's on Naviance. We'll be advertising it through our Instagram, ccc_cchs. And one more question Summer want to know: is nurse, does it give more time with your family?
Yes, ma'am.
Being a nurse. So.
Yeah, I answered your question, but yes, it does to me. I can maneuver things better. Mm-hmm.
Okay. All right. Well, thank you so much, everybody. We'll see you soon.
Bye. Stay in school. Bye.
Thank you. Thank you.
You're welcome.